If you've been researching Medicare Advantage plans, you've probably come across some strong opinions here on YouTube about HMOs.
Strong concept, strong time slot.
I'm talking about sentiments like, you'll lose access to your doctors, or prior authorizations are going to block all of your treatments, or even, they are just flashy plans with great perks but poor healthcare coverage.
That's not the truth.
But here's something interesting. Despite all the negative things that are being said, HMOs are still by far the most popular type of Medicare plan that there is today, with over 19 million enrollees.
Better believe it.
That's why in this brutally honest and comprehensive review, I'm going to show you how HMO plans work, compare them to the other two super popular plan types, and show you some actual HMO plans in the market. And finally, talk about why they're so popular and also touch on some of the potential downsides of enrolling in an HMO plan. Then at the end, I'll give you my brutally honest opinion about whether this type of plan could be right for you. And there's a lot to cover, so let's get started. Now, before I get into the details, let's take a quick refresher about what exactly Medicare Advantage plans are. So here's a quick chart going over all the details. When you sign up for a Medicare Advantage HMO plan, Medicare is essentially going to transfer the responsibility of your healthcare to an insurance company. And probably the simplest way I can describe these plans is that they're just like your typical employer health plan or like an Affordable Care Act plan. With these plans, you usually choose a primary care physician. You usually have a network of doctors and of hospitals that you go to. And usually you need to have referrals when you go from your primary care doctor to see a specialist. And in some cases, you may need prior authorization for some of the more comprehensive or expensive treatments. However, unlike group health plans, these plans are usually loaded with perks, such as coverage for dental, vision, and hearing care, which original Medicare does not cover. As well as this, you could have gym memberships or flex cards for groceries or for other benefits. And these plans usually also have a built-in prescription drug coverage, which is different than your typical standard Medicare. So you don't have to enroll in a separate Medicare prescription drug plan anymore. HMO plans also have relatively low maximum out-of-pocket limits, which is the most that you can spend out of pocket on healthcare in a year. This is especially lower when you compare it to other types of Medicare Advantage plans like PPO plans. Now finally, Medicare Advantage HMO plans generally have the lowest premiums of all Medicare plan types. You'll find a bunch of these plans with a $0 monthly premium, and of course that depends on where you live and what's available in your area. But that means essentially you don't have to pay an additional premium to get coverage under the plan because the premium is $0. Now let's go ahead and compare that to the second and third most popular types of Medicare plans, which are the Medicare Advantage PPO plan is the second most popular, and the Medicare Supplement Plan G, which is the third most popular. Now, if you'd like to pause this video, compare all these details, then go ahead. I'm just going to highlight a few of the key differences. For example, take a look at networks. With an HMO plan, the only time you get service outside of your plan's network is during an emergency. However, with the PPO plans, you can go out of network anytime, but you will typically pay higher copays when you go to doctors that are not in the network. Now, with the Medicare Supplement Plan G, you don't have to worry about networks at all. The only network you have to be concerned about is Medicare's broad network. Does the provider, doctor, hospital take Medicare? And if they take Medicare, then they also take your Medicare Supplement Plan G. Other key differences include the fact that the Medicare Supplement Plan G does not require you to get referrals or prior authorizations, but you'll also have to enroll in a separate Medicare Prescription Part D drug plan if you have a Medicare Supplement plan so that you have drug coverage. Meanwhile, Medicare Advantage PPOs are similar to the HMO in a lot of ways, but these plans typically have fewer perks and tend to have slightly higher premiums, slightly higher copays, and usually higher maximum out-of-pocket limits when compared to HMOs. So in a nutshell, Medicare Advantage HMO plans are the plans with the lowest premiums and highest perks or extra benefits, but often have the least amount of flexibility. But enough talking already. Let me go ahead and show you what an actual Medicare Advantage HMO plan looks like. Now I am here on Medicare.gov. I'm going to scroll down to find health plans now, and I'm going to put in a zip code. In this case, I'm going to put in the zip code here of the office and hit continue. That's in Las Vegas, Nevada. I want to look at Medicare Advantage plans. I'm going to hit find plans. I don't get help from any of these programs because we just want to look at the regular plans. Do you want to see drug costs? Today I'm going to say no because we just want to dive in and look at the plans directly. And now it gives me a list of plans. You can see that there are 38 Medicare Advantage plans available in the area. Now, it's nice that you can see this on Medicare.gov. Unfortunately, it's hard to do the other things like figure out how your doctors are covered and which facilities are covered under the plan, and look at things like extra benefits and what have you. I mean, it does show you quite a bit in here, but we use our system to get into the fine details. The first thing that comes up here is the Alignment Health Platinum Instacart HMO. Let's just take a look at this plan. You'll see that the first thing is that it has a $0 monthly premium. The maximum out of pocket in network, which this is only an in-network plan because it's an HMO, is $1,499. So right away that shows you the premium is $0. The maximum out of pocket for this plan is $1,499. That means that's your worst case scenario. Now you notice on the right it says it has vision, dental, hearing, transportation, fitness benefit, worldwide emergency telehealth. Now I want to say right away, this plan is a Las Vegas plan. It doesn't mean that you're going to have the same plan if you live in Tennessee or in Georgia or Florida or Arizona. You're going to have a different version of HMO plans, but this gives you an idea of what HMO plans look like. Now let's click here on plan details and dig in a little bit on this plan. Again, we know that it had a $0 monthly premium and it has no deductible. You see that the standard Part B premium is $185, but that does not apply to this plan. If we scroll down a little bit, because you see that health deductible 0, drug deductible 0. We'll keep going down a little bit to benefits and costs. Primary care doctor, a $0 copay. Specialist, a $0 copay. Diagnostic tests and procedures, you can expand that and see tests done to uncover the presence of illness or disease. So we're talking about testing, 0 copay. Lab services, 0 copay. Diagnostic, x-rays. Emergency care is the first thing that has a copay at $50, and urgent care, $0 copay. Let me go down a little farther. You see hospital, inpatient, 0. That means that if you're hospitalized on this plan, if you see a doctor on this plan, if you have a test done on this plan, whether that's a blood test or a colonoscopy, 0 copay. Preventive services, 0 copay. Ambulance, $50. Has some therapy visits. There's more to see down here. So I'm going to click the plus more so we can see more. You'll see that it goes down and there's just a lot of great benefits on these plans. We get to the drug coverage. If you look at the drug coverage, 0 copay for preferred generics, 0 for generics, $40 for brand name, and so on and so forth, showing you the costs. Let's look at extra benefits. With this plan, it has hearing, a 0 copay. It has a hearing aid for $195 to $1,750. Now, $1,750 for a hearing aid, that may sound expensive to some people, but if you have ever looked at a hearing aid, you realize that they are incredibly expensive. And a high-end hearing aid can cost like $10,000. What about dental? There's 0 copay for dental, 0 for cleaning, 0 for fluoride, 0 for x-rays. And then what about comprehensive dental? You can see that it has coverage for comprehensive dental as well. What about vision? There's your coverage for vision. You can get glasses, you can get contacts, you can have your vision test done, and then it goes down into star ratings and some other things. Okay, let's go back and let's look at another example. So that was the first one that came up in this area. If we scroll down a little, let's go past the alignment. Let's look at the AARP Medicare Advantage Essentials. This is a United Healthcare Plan, HMO, POS. HMO means that it's a health maintenance organization, HMO. POS means that there is some money to be spent out of network on a point of service. So in this example, it is an HMO with a small out of network benefit. Let's look at this one. We're going to go into the plan details. The first thing we see is that it has a $0 monthly premium and a 0 deductible, but it does have a $175 drug deductible. The maximum out of pocket on this plan is $900. So this is the very low maximum out of pocket. Benefits and costs, you'll see it looks very similar to the one we looked at before. You see your primary care doctor, you go to your specialist, 0 copay for those things, diagnostic tests, lab services. Some things like MRIs will have a copay up to $175 and x-rays are $5, so you can see what the copays are. Emergency care $140, urgent care $0 to $10. Hospital, $0 for all stays. Outpatient hospital, $0. And then you see the skilled nursing facility coverage, etc. So very similar to what we looked at before. Let's look at the additional benefits. I'm going to scroll down, starting with drug coverage. You see this plan has similar drug coverage to what we saw before. 0 copays on the generic tiers, $47 and $100 on the brand name tiers. The Deductible does apply in some cases. Now let's look at extra benefits. On this plan, there is hearing exams. There is a hearing aid prescription for hearing aids of $199 to $1,249 or over-the-counter $99 to $829. That's how much you would pay for a hearing aid on this plan. Preventive dental, zero copay for exam, cleaning, fluoride, and x-rays. Comprehensive dental, it has comprehensive dental where you don't pay for certain things. There is a limit to the plan. Let's see if it shows it under limits apply. It doesn't actually show it. Of course, in our system, we would show you exactly how much of a benefit there is. On the Medicare.gov, I don't see it here, but it is not endless. It's not that you can do unlimited amounts of dental on this plan. There is a limit to how much dental is available. And of course, when you're digging into the specifics of a plan, you need to really look at that. And that's why we recommend working with an agent. Vision, you hear zero copay for eye exams, eyeglasses, etc. Now keep in mind, these are just two examples of Medicare Advantage plans that are available to people at the zip code I used, which was 89102. That is a Las Vegas zip code. Now, the Medicare Advantage HMO plans that are available in your area will depend greatly because it depends on what's available in your area, which insurance companies have plans, what the population is. We find that in places with higher population of seniors, we tend to see plans with more benefits and lower costs overall. In areas where you live in a more rural area, it's harder for insurance companies to aggregate a group of people together and reduce costs. And so in those areas, we tend to see higher costs and higher maximum out of pocket. So we really have to look at the area that you live in to compare what's available to you. Okay, now that you have an idea of what these HMO plans look like, let me summarize the three main reasons to choose an HMO plan and the three main dangers of these plan types. Then I'll give you my brutally honest feedback about whether you should sign up for one of these plans or not. Let's start with the good stuff. Of all the Medicare plan types, HMOs have, on average, by far, the lowest costs across the board. Again, there are so many $0 premium Medicare Advantage HMO plans. And also, as we saw in the example earlier, the copays can be really low when you're in network, while the maximum out-of-pocket limits are also super reasonable. Now remember, if you choose a Medicare Supplement Plan G, you'll typically have to pay around $130 to $150 a month at age 65, and that increases every year for your age. That means that in some parts of the country, your Medicare Supplement Plan G could be as much as $300 a month. And that's why Medicare Advantage HMOs are super popular. There is no plan in the market that is more affordable on a monthly basis, on average, than a Medicare Advantage HMO. Another great thing about HMOs that not too many people talk about is that you'll get coordinated care with this plan. With an HMO, you choose first a primary care doctor. This doctor will be there to look after your healthcare needs. Think of your primary care doctor like a quarterback. They pass the ball off when needed, but they're primarily responsible for your health and for giving you a personalized healthcare plan. They'll be the ones to tell you what you need and where to get it. You won't be on your own to figure out things when you're on an HMO plan, which can be a problem if you're on a Medicare supplement plan. Let me give you an example. Let's say that something happens, knock on wood, and you are hospitalized. When you have a coordinated care plan like an HMO, then your healthcare provider is alerted, and all of your healthcare providers are concerned about what's happening there. They know what's happening there. They have access to your information. When you come out of the hospital, the plan and your doctor or provider are all working together to make sure that you don't end up back in the hospital and that you get better. Contrast this with a Medicare supplement plan. If you're on original Medicare with a supplement plan and you go into the hospital, your healthcare provider, unless they have an arrangement with that exact hospital to know what's happening with their patients there, which is very uncommon, they won't even know that you were hospitalized unless you call them, right? Then you return home from the hospital, you call your doctor and say, oh my goodness, I was in the hospital. They will say, what happened? What were you prescribed? What did the doctor say? Which doctors did you see? Why were you hospitalized? I've got to try to get access to that information. They don't automatically have that because your care is not being coordinated when you're on original Medicare with the Medicare supplement. So you have to be able to coordinate that yourself or have someone who can help you to coordinate those things. Another example would be, let's say that you're with a Medicare supplement plan and your primary care doctor makes a prescription. And then you go to your specialist, because you can see a specialist anytime you want. You don't have to have your primary care doctor refer you. And they order a prescription for you as well. You better fulfill those prescriptions at the same pharmacy every time. Otherwise, no one will know if there's a conflict in the prescriptions that you're being prescribed. Only the pharmacist would know that. So you need to make sure that you're going to the same pharmacist every time if you're on original Medicare with a Medicare supplement plan. Now, with a Medicare Advantage HMO, that would not happen. All of your doctors are working together and your plan is coordinated. So behind the scenes, there is nurses as well as technology making sure, meaning, computer programs and what have you, AI, whatever it is, they call it population health management. They are managing to make sure that behind the scenes, you're not going to have a conflict in medication, a conflict in treatment between all the different providers that you see. So this is a benefit to a Medicare Advantage HMO plan that some people see only on the negative side because they see, oh, I have to get a referral to see a specialist. My primary care doctor is going to be a gatekeeper. Is it gatekeeping or is it good healthcare management? I think it depends on the provider, depends on the doctor. So if you have a good doctor and a good HMO plan, then that's actually a benefit. Finally, the third great thing about HMOs is perks galore. Remember that original Medicare does not cover dental, vision, and hearing. And there are a lot of people that have to buy separate insurance for these things. Now, many HMOs cover these three things so that you can save even more money. Now, of course, before you get too excited about perks and extra benefits, always focus on your healthcare coverage when it comes to choosing a plan. You definitely shouldn't grab a plan just because of some shiny perks, but those perks can be a huge help to you, especially since everything is rising in cost every day. It's nice to have those extra benefits. But as I said, always prioritize the health care that your plan will provide you and the cost of that health care over extra benefits. So those are the three main reasons to get an HMO. Now let's touch on 3 dangers of HMO plans. One of the big mistakes that unfortunately I've seen people make is not looking at the network before signing up for an HMO. Maybe they were so drawn by the low cost or the amazing perks that they didn't bother to check which doctors and which hospitals took the plan. And when it came time for them to get treatment, they realized just how limited their options were. That's why it's critical to check who's in network before you enroll in one of these plans and what options are available to you for testing, for hospitalization, for doctors, for specialists, because it's really important when you go to get health care that you have access to good doctors and hospitals, particularly the doctor that you see now. And if flexibility is a deal breaker for you, you may prefer a PPO plan or a Medicare supplement plan instead. Another danger that many agents selling Medicare Advantage plans don't tell you about is that it can be difficult to switch to a Medicare supplement plan later on. You see, most Medicare supplement plans are going to require that you medically qualify to enroll. They'll ask you health-related questions and they can deny your application for coverage if you have a condition that's on their exclusion list. For example, let's say that you've had cancer or you were hospitalized in the last couple of years. That could end up in you being declined for a Medicare supplement plan. Now, with that in mind, most people get one enrollment period where they can choose any Medicare supplement plan without having to go through medical underwriting. And this happens when people first sign up for Medicare Part B and it lasts for 6 months. After that period, in most cases, you'll need to medically qualify if you want to get a Medicare supplement plan. Now, there are a few special enrollment periods that allow you to switch without underwriting. That's a topic for another video. And I'm talking about things like the birthday rule and moving and what have you. So what I'm saying is, and I really want to drill this into your heads, it's critical to compare your options before enrolling because it may be difficult for you to switch later on. The third danger that I want to talk about with Medicare Advantage HMO plans is prior authorization. Now, this is something that a lot of people blow way out of proportion, but we still need to talk about. There are many greedy sales agents out there, and a lot of them, I would say, are here on YouTube, who will try to make it seem like with the Medicare Advantage plan, you will never get the treatment that you need because they will always block you using prior authorizations. I think they're saying things like this because they primarily want to sell, or maybe are only qualified to sell Medicare supplement plans because there's 2 different plan types. So they try to bash Medicare Advantage so that you'll enroll in the type of plan that's going to pay them a commission. In reality, prior authorizations are nowhere near as scary as these people make it seem. In fact, according to a study published by the Kaiser Family Foundation, which is a nonprofit, 92% of prior authorization requests are approved immediately without problem. And if your request is denied and you appeal the decision, there's an 83% chance that it will be overturned. Now, having to appeal a decision can take time, and certainly it's an irritation. If you don't want that irritation, consider another plan type, like a Medicare Supplement Plan G. But what I'm telling you is it's not as difficult as the YouTubers make it sound. Typically, when you're appealing a decision, you'll find that it was your primary care doctor or your specialist that didn't include the reason for the thing that was needed to be authorized. So oftentimes the issue actually is with the doctor, even though it's the insurance companies that take a lot of flack for this. But because you know they're there, that is why prior authorizations are definitely a downside when you're considering an HMO plan. However, they're not nearly as much of a problem as most people make them seem. But now let's get to the big question. Should you enroll in a Medicare Advantage HMO plan? Well, in my brutally honest opinion, you should consider all of your options and decide what is best for you. 53% of people with Medicare have decided that that's a Medicare Advantage HMO plan. For the majority, maybe that's right, but that doesn't mean it's right for you. So I know you're probably wishing that I would just say, yes, you should. No, you shouldn't. It's not that simple. It doesn't work that way. Every single person needs something different. Every single person has a different combination of doctors, medications, hospitals they see, expectations on what healthcare will cost. And so we have to put that all together and figure out what's best for you. So my opinion is that you should enroll in the plan that fits you best, and that there isn't one plan that's best for the masses or best for everyone. Every person should get what's best for them. And that's what we do here at PlanFit. So if you want to find a Medicare Advantage HMO plan in your area, then don't hesitate to call or text my team of licensed insurance agents. They're available at 877-360-6565. Remember, our team of agents here at PlanFit are paid on salary, not commission. We can give you completely unbiased advice on which plan is right for you. In fact, we will look at every plan available in your area and recommend the plan that's best for you, regardless of whether that's a plan that pays commissions. Also, all of our services come at absolutely no cost to you. And finally, if you'd like to learn more about other Medicare plan options, then check out my other brutally honest reviews over here on our YouTube channel. That's it for today. Thank you for watching, and I'll see you on the next one.